people have with their back is when the quadratus lumborum gets into a little bit of protective spasm or harbors some tender points or trigger points. And there's several ways that you can treat this. So after you've done your evaluation, if you've determined that there's some tender spots within the quadratus lumborum, a muscle energy technique for quadratus lumborum that's really, really effective, and it's very nice and the patients like it, goes like this. If you take the arm over the head like that, obviously you're stretching out the latissimus, but you're also pulling up on the ribs, and in particular the 12th rib. And as you remember from anatomy, quadratus lumborum attaches to the 12th rib. If I come in like this with my hand and get the iliac crest, and if you notice, I'm going to make a force couple between my hand and my elbow, and I'm going to get my elbow jammed right up against my anterior superior iliac spine. If I hold down on the arm and I just have her hike her hip with about 20% of effort, so she hikes for 10, 9, 8, 7, 6, 5, 4, 3, 2, 1, release, take a deep breath, and all I do is push my anterior spine into my elbow, and I can stretch, 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 stretch that quadratus lumborum. And if I get to a point where I actually feel a little tightening again, I push a little farther, and then I have the patient hike up into my hand for 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Release, take a deep breath. And then I further stretch, stretch. And the stretching here is really just me lunging so that my elbow gets the force and transfers it to my hand. And I'll do that 3 or 4 times, and I'll go back and check for tenderness. Now another thing we can do, another technique, is strain-counterstrain. So I'll have the patient lie over on her tummy. And the screening for this muscle simply involves tapping on the spinous processes and see if I can find a spinous process that's tender or jumpy. I can come just lateral to the spinous process and push on the transverse process, and I can even go over and push into the belly of the muscle. So let's say I'm popping along just like this and I find one that the patient jumps at. I hold that point, reach over, grab the anterior superior iliac spine, and I passively lift her up a little, and I poke and say, how about that? Is that better? If she says a little better, not as much, I bring up a little higher, a little better, not as much, and then I get her up so far, and of course I'm going to fine tune it by pulling, and she'll say, there, it doesn't hurt when you poke anymore. What I do is I hold that for about 90 seconds, and after 90 seconds is up, I passively return and let the leg just, the anterior spine just come right down to the table like that, and I poke on that spot, and if that's not tender anymore, I go back and look for any more tender points, either in here or out in along the side of the transverse processes. Just by lifting the anterior spine up, I slacken quadratus lumborum, and it gives it a chance to relax a little bit. So those are 2 interesting ways that you can go after a quadratus lumborum. Give it a try and see how it works for you.